Alright, hello, my name is Elizabeth Mokpantai, and my presentation is on the multi-state outbreak of Salmonella typhimurium infections and its link to tomatoes. So step 1 being the background, during the years 2005 and 2006, there was an outbreak of Salmonella typhimurium in 21 states. And then based on the chart to the right, you can see that the most outbreaks occurred in the states Ohio, Pennsylvania, and Massachusetts, with those states being the black and white stripes on the map. And then this was found to be associated with eating raw tomatoes at restaurants in the United States, and it was found through a case control study of people ages 18 through 70. And then what Salmonella typhimurium is that it's an illness that lasts about 4 to 7 days, and it causes symptoms such as diarrhea, fever, and abdominal cramps. But this isn't seen as very severe because many people don't get hospitalized, and also many deaths aren't reported. So step 2, the current situation. The contaminated tomatoes were traced back to 25 fields from the regions of Florida, Ohio, and Virginia. And then a weakness is that since tomatoes only grow during certain time periods of the year, by the time the investigation had started and the infection already started to spread, the season was already over. And then that's when they had to continue the investigation the following year, which was 2007. But in 2007, that's where it was completed. And then an opportunity would be that there was no evidence of it continuing because all the contaminated tomatoes were able to be thrown away or they were already eaten. And then step 3, prioritizing core issues. Most of the patients lived east of the Mississippi River, but that's with an exception of a few that got salmonella when traveling. And then it was found that most patients got sick in the last 2 weeks in September 2006, with 93% of those patients who were reported, they got sick between September 14th and October 2nd. And then out of all of them, only 12% were hospitalized. And since this isn't very severe, there were no deaths reported. But the main issue here would be to find the source of the salmonella and to stop it so that future outbreaks can be prevented. And then step 4, analyzing alternatives. The model I used here would be the public health communication model. And then my first alternative that is associated with the model would be to inform and communicate with the public so that they are aware and they can be cautious about what's going on. So they can be cautious about what they're eating and how they're cleaning what they're eating. And then my second approach would be to communicate with the farmers and just to set guidelines such as cleanliness to stop the salmonella from the source. And then step 5, recommendations. One recommendation could be to have environmental and lab research done to find the source of the bacteria and to see what exactly is causing it. And then a second recommendation could be to require education on good agricultural practices. And then this could be towards farmers or even the people handling the tomatoes before shipment. Step 6, the action plan. In 2007, the CDC and the FDA stated that the salmonella outbreak was over and that there was no sign of it starting up again due to every tomato being discarded or consumed. But there are some ways to prevent it in the future, such as sampling and testing the fruit before shipment, or preparing them by treating the seeds or plants beforehand, or having interventions to try to improve the situation through the producer. And then in the pictures to the right, you see with the 2 leaves, the controlled tomato plant is to the left, and then the contaminated tomato plant to the right. The tomato plant to the left was the one that was being prepared beforehand. And then step 7, my own opinion. I think this should be made a priority with all the large amounts of tomatoes that are being consumed Cleanliness is what should be focused on, and it needs to be made sure that what is being shipped out is clean and ready to eat. This could be done during the growth, during shipment, and also the time period when they're actually at the restaurant. And all right, that is my presentation on the multi-state outbreak of Typhimurium infections and its link to tomatoes.